Hi everyone, welcome to Creating Careers. This is one of the season 2 events and today we're going to be focusing on dental careers. My name's Sarah, I'm one of the staff at Shaping Futures. I'm going to go over a little bit of the housekeeping for the session. The main one is that the session is being recorded, so if you want to watch it back, you don't need to make any notes today. It'll be available on the Liverpool City Region Careers Hub YouTube channel pretty soon. If we could ask you to keep your cameras and microphones off, that just helps us with the bandwidth of the session. And you should have a chat box on your screen where you can send any questions in to myself, my colleagues, or our interviewees today. If you're not sure where the chat box is, depending on how your Zoom layout is set up, it'll either be along the bottom or the side of your screen, and it just looks a little bit like a speech bubble. So you can pop any questions in there and we'll kind of pose them back to our interviewees at the end of their session. Little bit of an overview of what today is going to look like. I'll stop speaking in a minute and hand over to my colleague Leslie-Anne, who is going to run an interactive session for you. Once that's over with, we are going to do the interviews. At the end, you will have a chance for Q&A and we'll cover a little bit of next steps. But just before we get into that, I do want to remind everyone that although this is a Northwest-wide event and you may hear from staff in an area that's not your local area, you can get support from your local Uni Connect partnership. You can see them on the screen there with any questions you've got about your choices, whether that's GCSEs, A-levels, apprenticeships, university application, or whatever it is that you need help with. Okay. One of the ways that you can do this is you will have received an email from my colleague Abby about a Google Classroom when you got the link to this Zoom. We do really encourage you to join it, and we will pop the info for the Google Classroom in the chat as well, so you can get through there. But everything related to this is all on there, including links to the Uni Connect partnerships. So you will be able to get any support that you need there. Okay. That is pretty much everything from me. So I'm going to stop sharing my screen now and hand over to Leslie-Anne. Thank you.
Hello everyone. Right, I'm just going to share my screen so we can start the next part of the webinar. So we'll just get that full slide. Right, can everyone see that full screen?
Yeah, full up.
Thank you, Sarah. So for those who are new to Creating Careers, before every live webinar, we set some pre-work, and that is to ensure that you are as prepared as possible for the live session. Now, how we like to kick off these webinars is with a quiz that is based on your learning from the pre-work, and that is just to make sure you've got a little bit of feedback on that work set and that you can come up with some even more thoughtful questions and more preparation ready for the interviews that are going to happen later in this webinar. So how that will happen is we will have an interactive quiz. We'll use the chat, we'll use some Zoom polls, and please get as involved as possible. No one is taking any scores throughout this session, so you won't be judged or ranked. It's purely just for your feedback and to help each other, and it makes it a little bit more interesting the more and more that people get involved. So please get as involved as possible, and as you're going through this quiz, if things pop into your mind that you want to know more about, put them in the chat, and also you can ask during the Q&A stage later on in the webinar. So to start off, dental careers pre-work quiz. I want you to think about what roles, based on your pre-work and based on your own experience as the dentist, we should all have our own experience of what it's like going to the dentist. Based on your experience and your work in the pre-work, I want you to list as many different roles within the dental team that you can remember. Use the chat. So open that chat up and type in as many different roles, job roles, as you think are in any dental team or any dental surgery or practice that you go into. Think about that moment you walk in the door in the dentist. Who are you seeing? Who's got a job there? Who are you dealing with? And all the roles that you listed and looked at in your pre-work. So come on, let's not be shy. I know there's people on the call. Open the chat up and put some ideas in. Okay, fantastic. Thank you, Ava. We've got the dental assistant. Okay, brilliant. We've got a hygienist, thank you, wonderful. We've got the reception, definitely as you walk in, the first people you see, who you report into. So we've got 3 there. Anyone got anything else to add before we go on to the next section? So we've got the dental assistant, we've got the hygienist, we've got someone that Ava, wonderful, you've just read my mind, the actual dentist as well. So let's have a look at these roles that are within the team that I asked you to look at in the pre-work. This list isn't exhaustive, so when we have our interview later with Lauren and Catherine, they may be able to tell you about other roles that really support their work, but just for the pre-work quiz, we'll look at these roles. So we've got dentist, we've got the dental hygienist, which was identified, thank you for that. We've got a dental nurse, there's dental technicians and dental technologists, there's the dental therapist, there's dental support workers, okay? So in a moment, in the quiz, we will look at exactly, well, we'll give you a brief overview of what those roles are and remind you, and based on what you'd looked at in your pre-work, so you should be all prepped ready for that, but we'll go through that in a moment. Now, before we look at those roles in a little bit more detail, I just want to remind you of the NHS values, and then we'll come back to these dental roles. So the NHS have 6 key values that they expect all members of staff to demonstrate throughout their work and life every single day. So they're working together for patients, respect and dignity, everyone counts, commitment to quality of care, compassion, and improving lives. So if you work in the NHS, you have to show that you share those values, you demonstrate those values, those belief systems of how you think you should behave. Now, the reason why this is really important to you is that if you are applying for an NHS job or an NHS course, you have to, in your application, show that you share those NHS values. It's called values-based recruitment. Okay, so at this point, if you're, maybe at school, it's pretty likely you won't have experience of working within the NHS to demonstrate those 6 values in your application. But you can transfer your experience from school life and home life to demonstrate in any applications that you've shown those values, you show compassion, maybe you've worked in a team, maybe you've shown that everyone counts. You can show all of those values in your application through other settings. And what we can do is support you with getting to grips with how you can do that. So this NHS Values Challenge, it is in slide 3 of your pre-work pack that was sent out before this session. If you haven't got a copy of it, go to the Google Classrooms, you can get it there. If you hover over each of the 6 values, there'll be a YouTube video that explains that values. There is a challenge there, and we can also support you more with showing those NHS values. So please get in touch with us via the Google Classrooms or our email address that I'll share later on to really help you get to grips with those NHS challenges, values. No matter what job role you want to go into within the NHS, you have to have those values drilled down. And to give you an example of why the NHS puts so much importance on them and link into dental careers, I'll give you an example of my personal experience of, I've had the same dentist for 30 years, right? And my dentist has had to show those NHS values with me on numerous occasions throughout my childhood because I do not like the dentist. I've got an irrational fear of the dentist. I don't know why, it just makes me nervous. And as a child, my mother had to bribe me to go to the dentist through pocket money and, I don't know, toys and things. And when I'd get to the dentist, my dentist would have to show all those NHS values to me to make me feel comfortable. He would have to work together, that first value, with my mum to make sure that I would have the treatment. There was one point where I refused to go into the dentist chair because it moved and it made me feel frightened. It was only little. I had to have all my routine checkups standing up under the light. And my dentist showed those NHS values to me, the compassion, respect and dignity, a commitment to giving me quality care right the way through my life. At 30 years on, I only saw him 2 weeks ago. He's still my dentist, and I still, I've been encouraged enough to go for my checkups and make sure that my oral health is, where it should be. So those values are essential. Make sure you take the time to do this challenge. Okay, so off on a tangent there a little bit, let's get back to the pre-work quiz. So those roles within the dental team that I described at the beginning, let's have a little look at how well you know them from your pre-work. So I want you to tell me which role I am describing. I'm going to describe something. 3 options are going to come up on a Zoom call. I want you to tell me which role within the dental team am I talking about. So first role, you'll make the dentures, the crowns, the bridges, and dental braces that improve the patient's appearance, speech, and ability to chew. So what role am I talking about? Am I A, talking about the dental nurse? Am I B, talking about dental technicians and technologists? Or C, am I talking about the dentists themselves? So when that Zoom poll comes up on your screen, I want you to tell me, who do you think I am describing? Let's see what your answers come in. So a few of you may have braces. You're at that age in secondary school, or a lot of people have braces. Who are the people who are making them? Okay, just waiting for the answers to come through. Have the answers popped up, or is that just my screen not sharing it with me?
Yeah, so most people have gone with dental technician or technologist.
Wonderful stuff. Thank you for that, Sarah. Absolutely, it is the dental technician. Good start. So next one, what role am I describing? You'll perform some of the most straightforward work, usually undertaken by a dentist. You'll have independence without the full responsibility of running a practice. You can also provide treatment in other parts of the community, such as schools and care homes. Who am I talking about? The dental nurse, the dental therapist, or the dental hygienist? Who do you think performs some of the more straightforward work?
So we've got dental nurse winning at the moment.
Okay, fantastic, Sarah.
A couple of people have gone for dental therapist, but dental nurse is winning pretty substantially.
Okay, I'm a little bit cruel, and I do enjoy it sometimes when the participants are tricked a little bit. I did anticipate that would be the answer, but it's actually the dental therapist. So dental therapists will carry out more routine work that dentists do just to support the team and patients. So things like scale and polish, x-rays, impressions of molds of your teeth while they're preparing for surgery, and crowns, extractions. Dental therapists will do that. Okay, so there's an interesting role for you to think about within the dental team. So next one, we've got 2 more to look at. So you are an important part of the dental team. You prevent dental problems in adults and children. You'll help children and adults look after their teeth and gums. Sometimes you might be working on a one-to-one basis, and on other occasions you'll work in groups. Who am I talking about? Who helps prevent dental problems? We've got the nurse, a support worker, dental support worker, or the dental hygienist. Who am I talking about?
Most people have gone with hygienist, but there are a couple that have opted for dental support worker.
Fantastic, thank you. The key was really in the word prevention, preventing dental problems. So it is the dental hygienist. So the dental hygienist will advise all about how to look after your oral health, prevent issues happening in the future, make sure that your teeth and gums are lovely and clean and healthy. So our last one, who am I describing now? Okay, so you'll support the dentist in all aspects of patient's dental care. You may help with reception work and could help any member of the dental team treat patients of all ages. And they're talking about the dental nurse, the dental technician, the dental hygienist. Have I been cruel and put 2 roles in twice, or am I talking about someone else? Let's see what we come up with.
So dental nurse has won with 100%.
Oh, brilliant, wonderful stuff. It is, of course, the dental nurse. So the dental nurse will assist surgeries with the dentist. They'll maintain equipment, they'll manage patient records, and also an absolutely essential role for the dental nurse is the dental nurse can reassure patients who are a little bit anxious, like I was in the youth. I've got another tale about the dental nurse where one day I bumped into the dental nurse when I was quite young. I was in Sainsbury's and I had a bag of sweets in my hand. She said hello to me and I ran away because I thought she'd tell me off for having sugar, eating too much sugar and impacting my teeth. So again, that dental nurse was required to show the NHS values with me, and I had to have a lot of patience with my antics in my youth towards the dentist. So We've looked at all those roles that were covered in your pre-work, but we haven't looked at the ins and outs of what the dentist does. We can look at that later in the live part of the session when we have our Q&A. But I want you to think about this now. Where can dentists work? Think about the setting, the environment, the building. What types of places do you think dentists work in? What types of people do they work with? So I want you to really think about your experience or what you read in your pre-work and put your answers in the chat. So think hard, what kinds of buildings, places, people do dentists work with? So we've got Ava, thank you. Dental practices, hospitals, yeah, absolutely spot on. Anywhere else anyone would think that a dentist might work? Any ideas? Thinking outside the box? Oh, I love that. Houses, absolutely. So you may go to people's houses to perform dental treatment. Anyone got anything else? Pleased with that response so far. We've covered some of them. Anyone got anything else just before we go on to the last part? Dental surgeries, thank you, Samuel, spot on. What we'll do is I'll go through them with you now. So we have general dental care. So that is your general dental practice, the type of dental practice that I terrorised as a child. So your high street dentist that you'll go to for your routine checkups and to meet your dentist. Now there, you can be offered NHS treatment or private treatment. So for example, if you're offered a filling, you might be offered a price for the filling on the NHS, or you might be offered maybe a white filling on private price. So dentists can work in high street dental practices privately or with the NHS. The next option is community dental care. So this is an option for anyone who's interested in working in dentistry. This is for people who find it difficult to get to their general high street practice. Maybe the elderly, people with mental health issues, people with physical disabilities, maybe people with special educational needs, those who don't find it easy to physically go to the dental practice. So that's where the community dental care will come into place. So those dentists can work in schools, they can go to people's homes, as was rightly identified in the chat. They can work in nursing homes, and they can also work in like mobile dental clinics as well. So there's lots of different varieties of settings that dentists can work in. We've also got dental public health. Now this is a little bit different to working in the general practice dental. If you work in dental public health, you're working with the community rather than an individual patient. And what they do is they make sure that dental services all across our regions are meeting the needs of patients and are up to standard of what should be expected and what is the best for our general community. So if anyone's got any questions about that one, put that in the chat and we'll answer that later on in the live section. Hospital dental care, as was rightly identified. So patients who are in hospital a long time, maybe with other illnesses, they will still need dental care, or you might be in for a short amount of time and unfortunately you may need pain relief. As well as other issues. So dentists definitely work in hospitals, and there's probably a lot of scenarios in which dentists are required. And lastly, one to consider if you're thinking about this career is armed forces. So the likes of the Army, Navy, RAF, they all employ dentists. So that is an area you could consider if you are interested in this career. Okay, so I am spot on 10:02. That is my deadline. So just very quickly before we go on to the Q&A section. At Creating Careers, we offer one-to-one mentoring support to help you with your pathway into a career in health and social care. So whether you're interested in dentistry in general, you're interested in a specific area of dentistry, you're interested in a totally different NHS career, or you just want to work in the NHS and you don't know how, you don't know what to do, come to us. We will support you. We can mentor you, we can give you advice and guidance, we can give you resources and ideas of events. We're not scary. That can look however you want it to look. It can be email conversations, as little or as much as you want. Come to us. We are really, we're useful and we're there for you to help you and support you. So I want you to tell me, your polls come up on your screen. Are you interested? I'm just interested in your feelings about this. Yes, not sure, no. Let me know how you feel.
So we've got 4 people who said yes, they're definitely interested, and we've got 1 person who's not too sure at the moment.
Okay, so every single person then, even if you're not so sure, be getting in touch with us. I will put our email address in the chat to ask more information about that mentoring option. It is invaluable. Anything to do with the career, even if you want to know about the NHS values, anything at all, get in touch with us and we can help you make your applications, make your decisions, and give you that step ahead in your future health or social care career. So I'll put those details in the chat. You can even get in touch with Google Classrooms. So I'm only 1 minute over my time slot, so I've done quite well there. So hopefully that's given you a little bit of prep ready for our main event. Please put your questions in the chat, and we're ready to welcome our wonderful volunteers to tell us more about their interest and careers. So thank you for listening.
Hi everybody, my name's Sharon Blaney and I work at the Liverpool City Region Combined Authority, and I'm really pleased to be able to have a chat with Catherine Johnson, who's actually a restorative senior dental nurse, and I was thinking, oh, what does that mean? Because that didn't come up in our information there. So I think Catherine can help us with that. So Catherine, welcome. It's lovely to see you.
Nice. Can you all see and hear me?
Yeah, I think, well, can everybody see Catherine and hear her? Yeah?
Yeah, that's all fine.
Great,
Yeah.
lovely. Okay. So Catherine, could you tell us what your job title means, please, and basically what it entails?
Okay, so as you've just mentioned, I'm a restorative senior dental nurse. So I'm actually based at Liverpool Dental Hospital. Now in the dental hospital, you've got different floors. So you've got your orthodontic department, restorative department, special care. So I'm one of the seniors on restorative department, which really means restoring teeth. So my job here on a day-to-day basis is I am a dental nurse and I'm also a sedation qualified nurse, but I'm also in charge of dental nurse rotas. So I've got about 54 nurses under me and 4 dispense, and then I have to allocate dental students to make sure that they've all got a space to see their patients.
Gosh, that's a big role, isn't it?
Yeah,
quite broad.
Yeah.
So what was your pathway? I mean, obviously we all start somewhere, don't we?
Yeah.
And I'd really like to hear your story about how you first got into dentistry. So what happened with you, Catherine?
Mine's a bit of a funny story, to be honest. So I actually left school with no qualifications at all. I was a little bit of the class clown in school and I didn't really apply myself. So obviously I was living at my mum's house and my mum was like, Catherine, what are you doing with your life? You can't stay here for the rest of your days and just go out and have fun with your mates. So she dragged me up to the job centre, and obviously I was sitting in the job centre and didn't know what I wanted to do. And then he just happened to mention an apprenticeship dental nurse. So I was like, yeah, I can give that a go. So I went for the job. I got the job, but then I had to go back to night school and get qualifications, my GCSEs again, basically. So I had a job, and alongside that, I went to night school then to get my GCSEs. Once I got that, then I was able to go on to train to be a nurse. So that was another 2 years at night school to train to be a dental nurse whilst working alongside my job. So then I qualified then and got my nursing degree. And then after I got that, I decided general dentistry wasn't for me. So I made the move to community. So being a community dental nurse, obviously you spoke about it briefly before. I was in the hospitals, I worked in the prisons, mobile dentistry, used to go out to the schools and show them how to brush the teeth. And then once I was doing that as well, I decided I wanted to do a post-qualification in sedation. So I also went to university to do that. So I stayed in community for about 12 years. And then obviously I'd done everything that I wanted to do there, moved on to the hospital, and I was just a normal dental nurse in the hospital. And then started teaching basic life support classes and things like that, which opened a couple of doors. And then I'd done a teaching qualification, and then obviously branched out and became a senior dental nurse, where I now teach dental students and I teach classes and things as well. So that was my little story.
Gosh, that being taken to the job centre.
Yeah.
I can imagine that one.
Right there by my mum.
Good for mum, eh? We've got a great outcome from that. You mentioned that you had to go to night school because your qualifications weren't what you needed. So what qualifications did you do at night school? What was asked of you?
So I'd done English, maths and a science as well. So now I think you need them now at a grade C to be able to apply to become a dental nurse. From what I remember, I'm sure it's still a grade C to become a dental nurse.
Okay. And once you'd achieved them, obviously you could move on. So
Yeah.
in relation to your into the job that you do now, what does a typical day look like to you? How does it progress?
So unlike a normal chairside dental nurse, my job has got a big variety of things going on. So obviously if I'm chairside, then there's another senior taking my spot, so she will deal with all of them issues, and I will just concentrate on the patient that's chairside. I will be doing sedation. Obviously you work with phobic children, so you touched on before about the standards and things like that and the values, and so that's part of my role in that aspect. Obviously it's getting children to be able to get their dental treatment and, you know, giving them gas and air, we call it happy gas and things like that. So that could be one day. The next day I could be in and I'm teaching dental students cross-infection, how to zone their areas adequately and things like that. Or if I'm doing my senior job, I'll be spend a day doing rotas for 54 nurses and chair allocating. So my job's got a big variety of things going on. So every day is different for me.
And I think really what that does show our students is you can go in at entry level and start at one area, and you started as an apprentice nurse, and then progress into different areas. So what helped you to sort of make those decisions to go into the different areas that you went into?
I found, because obviously I'd grew with my job, I found that I enjoyed the teaching aspect a lot more, so that was the side that I pursued. Other nurses, they don't like that as much as I do, and then you can do oral health post qualifications, and then you'll get your own few little patients, and you can teach them how to clean their teeth and manage their oral health and things like that. And or you can progress, you can move from being a dental nurse, so you can use that as one avenue, and then move over and try and apply to become a dental therapist and hygienist, because then you've got your nursing qualification, which then gives you enough to move over. You've just got to apply for university. So you'll find that people sometimes come in at entry-level dental nurse and they quite enjoy that throughout their career. Otherwise, they can branch off into different areas. So because there's so many different areas within dentistry, it's sort of whatever you excel at and what you like type of thing. Because you could have dental students also coming in and they want to do a lot of surgicals, oral surgery and things like that. And then they'll get in there and they'll see the first surgical and they just faint because they're not used to the blood and things like that. And they realise that type of dentistry is not for them. So then they can move off and do obviously dentures and prosthetics and things like that. So there's lots of different areas and avenues what you can move into.
Gosh, that demonstrates a lot of variety. Thanks for that. So can you describe how you work with other NHS professionals? What sort of links do you have and how do you connect with them?
So basically, we'll have monthly multidisciplinary treatment meetings. So it's basically how different areas can come together to create a better overall experience for your patient and things. I also work very closely with infection prevention and control to make sure that we're upkeeping and staying in line with current standards of infection control. So we do that. I also work with the university quite close to provide training for dental students. So when they first come in at year one, making sure that they know how to don and doff their PPE, how to do correct cross-infection and decontamination and cross-contamination and things like that. So it's setting them up with them fundamental things for them to go on then to dentistry.
Okay, thanks for that. So just sort of reflecting on how where you started and the sort of roles that you've done, if you could give advice to a student who's interested in your area of work, you know, you've given a lot of information there. What advice would you give Catherine?
My advice would be, don't do it the way I did it. Don't do it the harder way and slack off in school. And then, because after school, I felt like I had to work almost harder than everyone else because I had the job, but then I had to go to night school as well. So just trying to make that transition as easy for yourself. So if you get your baseline qualifications at the beginning, it makes it a little bit easier to move on to something else. Whereas I was overwhelmed and I had to do it all together at the same time. Also, you must really love what you do to be able to get up and do it every day. As hectic as my job is, I feel I thrive on that, and I'm able to work well with that. And, you know, it gets me going, and my job still gets me excited now. So if you get enough for a job that doesn't excite you, you're not really going to want to do it.
Yeah, very, very true, and good advice. So if I was to ask you, what's your favourite part of the job? You're very inspiring in what you're telling us, and I know you're passionate about it.
Yeah.
Or if you could hone that down into what are the favourite parts of your job?
I think my favourite part of my job is patience and interacting. I'm much of a people person, so I get to deal with that every day of my life, you know, and I couldn't really work. I'm not built to just work on my own in an office. I like to interact with different people and things like that, and troubleshooting as well. And I like to come in and then, you know, problems are thrown at you and you're able to solve them problems and then move on to something else. And so I think that's the favourite part of my job. And the job satisfaction with your patients, you know, when you've made them smile, things like that. And, you know, you've changed their whole outlook on life or dentistry because you've got them over that fear. And now they can get their treatments on and things like that. And just, you know, they're so grateful and they'll give you a cuddle, and they're like a totally different patient in the end to when they first walked in. So I think that's the most favourite part of my job.
And that's lovely to hear.
Yeah.
I don't think there will be, but do you have a least favourite part?
Oh God, yeah. I think that is staffing issues and the stress that puts on everyone. Just obviously coming into work and then you're having to deal with a lot of sickness and things like that, and it just puts a lot of pressure on the rest of the team, and I find that the most stressful. So it's making sure everything's manned and everyone's got a nurse, and, you know, and we're doing that to a safe capacity. So I feel that's the most stressful part of my
more
job.
the organisational side of things rather than the actual hands-on operational side.
Yeah.
So from a point of view of the skills and the knowledge that you learned at school, what of those skills that you learned and the knowledge that you took on board at school, what do you think have you taken forward into this role? What do you use today?
As I say, obviously I was a bit of a joker in school, so I had to do everything afterwards. But I would say being creative, collaborative, you know, being able to work within a team. So obviously all the sports and things like that I was involved in. I'm able to work in a team here now. I'm able to work autonomously on my own. And so it's things like that I've brought to this job, I feel.
And I think your communication skills as well, very key, aren't they, from a point of view of the sort of role, you know, communicating with patients. Catherine, it's been really interesting, you know, the information that you've shared and your journey, gosh, you know, from being taken down to the job centre to where you are now. I bet you thank your mum, don't you?
Honestly, I do every day, and she doesn't let me forget it, to be honest. But no, I'm very grateful for it. And anyone, you know, you don't have to have everything set in stone from the get-go, and you don't have to have it all figured out. And just because you're not doing so well at the time doesn't mean that you can't move on and progress later on in life. So
that's wonderful advice to share. Catherine, thank you so much. I know you can't stay around for the rest of the webinar, so if anybody has got any questions, if you can put them in the chat and we will endeavour to answer them. We'll connect with Catherine if it's anything quite specific, and we will come back to you. Well, thank you so much. That's been really informative, and it's been lovely to meet you.
Oh, you too. Thank you.
Thank you.
Bye, guys. Bye.
Bye. And I'll now hand over.
Yeah, hello. So I'm really excited to be interviewing Lauren. My name's Andy. I work for Future U. Future U is the Lancashire branch of the National Collaborative Outreach Project. So Sarah works for the Merseyside branch, Shaping Futures, and I work for the Lancashire branch. But you don't really want to hear about me, do you? You want to hear about Lauren. So I'm going to start asking the questions now. I'm very excited to hear about all this because I know very little about dentistry at all. So I'm going to start with nice, simple questions to start off with, Lauren. Could you tell us about your job title and what your job entails, please?
Yeah. So first of all, can everyone hear me okay before I start?
Yep.
Yeah, wonderful. So yes, my name's Lauren. I am a recently qualified dental nurse assessor for the School for Dental Care Professionals here at Manchester Dental Hospital. And all that means is, so we deliver training for pre and post, so people who would like to become a dental nurse, and then for those people who would like to go on to do further qualifications. And I work closely with the trainee dental nurses and provide assistance to the tutors and obviously support the students as well.
Okay, really interesting. So could you tell us what your pathway was into this career and what qualifications did you need?
Yeah, so a lot like my colleague Catherine, when I left school, I didn't actually have any GCSEs. I was kind of messed around a little bit as well and didn't concentrate probably as much as I should do. Didn't really know what I wanted to do. I was drifting in between jobs, and I actually was living in Spain at the time. And I had a friend who worked in a dental practice, was an English dental practice, and there was a job opening for a trainee dental nurse. And I went for the interview, really got on with the practice principal. So that was the clinician who owned the dental practice. He offered me the job, and the rest is history. That was 15 years ago now. So yeah, I kind of worked in the dental practice with him. It was a private dental practice, and he was really interested in the kind of the surgery side of things, so minor oral surgery, so implants. And so I really kind of got to see quite a various clinical activity for a trainee dental nurse. So I worked there for a few years, moved back to England. Just to kind of explain, so in Spain, you didn't actually have to do a qualification. There was no professional registration. Upon moving back to England, I signed myself up with a training provider. I registered for the apprenticeship, and as I didn't have the maths and English qualifications, I did have to do those alongside my apprenticeship as well, and it was the best thing I ever did. And kind of just to say to mirror what my colleague Catherine said as well, if you can do it when you're at school, it's obviously better, but it's not the end of the world. There is options out there for you.
Yeah, I think you're both great advocates for that, aren't you?
Yeah.
It is better and simpler to be doing things kind of when you're in school and getting those GCSEs. But we all learn as we get older that life isn't a linear path, is it? And you can often kind of take opportunities later on, which bring you back to kind of like the type of things that you really suit towards doing. So you're really good advocates for that.
Yeah.
Okay, so next question. What does a typical day look like for you?
So in my new role as a dental nurse assessor, I have 20 students more or less. So my colleagues, they have more, but because I'm new to the role, my caseload is a little bit lower. So I have 20 students. There's classes that are in on various days, and basically it's just providing support for them. So we carry out observations. That's when we go out to the dental practice to observe them doing their clinical activities. We carry out simulations here in the school. So that's for things like the basic life support. So on the dummy, when they've got to do the chest compressions, put a colleague into their recovery position, we have to watch them in a simulated event and how they would manage with a medical emergency. Obviously, it's a qualification, so there's assignments involved. The tutors deliver the knowledge-based lessons. The learners then complete their assignments and upload their assignments to, it's called OneFile, which is their electronic portfolio. And as assessors here, that's what we log on to, and we mark their assignments, give them any feedback and pointers just to kind of improve things.
Okay, really good, thank you. And could you describe, you've answered this a little bit already, I guess, but I wonder whether we could go into a little bit more detail about how you work with other NHS professionals.
Yeah. Yeah, so it's my NHS Professionals. So we're based in the kind of in the hospital. So we do have in-house apprentices. So they're employed by the trust. They work downstairs on the clinics. So obviously we have not myself, but one of my other colleagues. She deals closely with the clinicians within the hospital, and obviously going out to the general dental practices, liaising with the clinicians there, yeah.
What type of skills do you think are particularly useful when you're dealing with kind of people from maybe other sectors of the NHS?
Communication is always key. You've got to be able to effectively communicate with other people, whether that's verbally, kind of written format. Effective communication is massive. Yeah. You've got to be kind of respectful as well, kind of linking back into those NHS values that were mentioned at the beginning. Making sure that you're treating everyone kind of with respectfully and with dignity, and yeah.
Good. All right. Thank you. So if you could give any advice to a student interested in working in your area, what would it be?
Contact your local dental practices. It's a little bit different with COVID, but I do know the kind of restrictions are lifting a little bit now. So you could possibly contact one of your local dental practices, let them know that you're interested in dentistry, and see if they would be happy for you to go in to do a little bit of shadowing. Obviously, it will all depend on the practice and their policies, but that would be a really good idea. Because dentistry, we work with our hands, so anything manual dexterity. So if you play an instrument, if you are good at art, completing any applications, pop that on there because it will only go in your favour.
Oh, that's really interesting. Yeah, I like that advice. Okay, fantastic. What's really interesting about that, I guess, Lauren, is that taking advantage of little opportunities that you might have, or making opportunities for yourself as well, is so important for young people, isn't it?
Absolutely. So yeah.
Going and volunteering to go out into and get experience in that work is something which is really valuable for CV building.
Yeah. Yeah, cool. Definitely.
Okay. All right. So bit of a fun kind of question now. So what are your favourite, and my favourite question, what are your least favourite parts of your job?
So I would say my favourite part is, and this is when I was dental nursing as well, I like to see a result. So kind of when you're starting at one point and you can see that there's a result at the end. So whether that be from a dental kind of aspect, if that's a patient coming in, and for orthodontics, if they've got crooked teeth, they have the braces popped on, and their reactions when they have those braces taken off, it's wonderful. It's really nice. Like, it can be life-changing for some people if they're really quite unhappy with their appearance of the teeth. In the job role that I'm in at the moment, I would, again, it's kind of just the journey from a student coming at the beginning and really not having a great understanding of the role as a whole, and then them coming to the knowledge-based lessons and obviously seeing them through the qualification and qualifying and getting a professional registration. That's great. The least favourite is I do enjoy a busy workload. I do enjoy kind of busy, and I don't particularly like a desk job necessarily where I'd be sat behind a desk all the time. However, you have to be organised, because it can get, when you're managing students who are all over the place and all different kind of workloads, and we've obviously got other pressures of working within a trust, it can get a little bit hectic sometimes, for sure. Yeah. So yeah, I'd probably just say the workload sometimes. Yeah,
those organisational skills that you pick up over time are really important, aren't they?
Yeah, absolutely. Yeah.
But also, I guess it's the importance of a little bit of compromise as well. So it's accepting that there are always aspects of, even if you love a job, there are aspects of it that, you know, is not necessarily your strength or your favourite thing to do, but it's compromise, and you have to do those in order to be able to enjoy the rest of your job, don't you?
Exactly. There's pros and cons with anything in life, isn't there? And I think I would definitely say that my pros outweigh the cons in my job role. When I was a dental nurse, I remember when my assessor came out to the practice to see me, and I remember thinking, I want to do that. And that's what I've kind of been working towards. When I was to become a dental nurse assessor, you do have to have a dental nursing qualification. And I just branched out doing different things. Again, what my colleague was saying, there's lots of different areas that you can go in from being a dental nurse. I have friends who were really happy being dental nurses, and they still are working in practice, And then, but if you want to progress, there's so many doors open to dental practice management. You can work in a hospital setting, you can work within the general practices, doing those post-quals. So like myself, I did the oral health education. And what that meant was that I got a little list of patients, and the clinician would refer patients over to me that would need help with their oral health or oral hygiene. So we'll go through toothbrushing technique and just showing them how to improve possibly the diet as well. Then I was a locum dental nurse, so I worked all over the Northwest, and with that, I saw my earnings increase, and then we'll just wait for a job to come up in the hospital, and here I am.
Oh, that's really good to hear. Yeah, okay. And final question, then you're off the hook. What skills or knowledge did you learn in school that you still use today?
IT skills, I'd say, even in the dental practices now, it's all, I'd say 99.9% of the practices, its majority is all computer based. So those IT skills that I learned in school way back when have definitely come into play. And I would probably just say teamwork as well. So I was on the athletics team for school, so doing the relays race and kind of cheering everyone on. And working within a team, if you're working in a dental practice as a dental nurse, or anywhere where there's a large team, you have to be able to work together just to make your day go easier. And we're all about patient care as well. So, and that's kind of patient interest comes first, and working as a team comes with that. Brilliant.
Yeah, it's something that I've come to understand even more kind of over the time of listening in on these type of conversations. In the NHS, that teamwork it's you're like a band of brothers and sisters, aren't you? It's so important. Like,
yeah, absolutely.
It's obviously important for every profession, but for the NHS, it really is like a hugely important thing. Okay, well, that is all the questions. So thanks for your time, Lauren. That was really useful, and hopefully some of our young people will gain some really invaluable insights into that. So thank you, and I'm done for my job now. So I'm gonna hand back over to Sarah and the rest of the team. But yeah, thanks for your time.
Lovely, thank you very much.
Well, thank you so much for our speakers. That was so interesting. So last reminder, guys, please do pop any questions in the chat. If you feel a bit shy and you don't want to kind of ask them yourselves, you can send them directly to like me or Leslie Ann, and we can ask them for you. But we've just got a couple of little bits to go over last to give you guys a chance to think and get your questions in. And then we'll let you enjoy the rest of your sunny evening. Okay. So you should be able to see my slides again now. So in terms of next steps following on from this, it will go up on the Liverpool City Region Careers Hub YouTube channel fairly quickly. So you can go back over this. If you didn't understand something, you missed something, you can rewatch it as many times as you would like. And on the YouTube channel, you'll also be able to see the whole rest of this series. So far that is about 11 webinars that we've done on all different types of careers. So if you think this is interesting, you want to hear more, that's all available on there. You'll also get a follow-up email, which should ping into your inbox anytime now, and that will include a few different bits and pieces. One is the post-work roadmap, which is essentially a document that Leslie Ann's put together to kind of follow on from the pre-work and get you reflecting on this, building those skills that are really important within the NHS, thinking about whether this is the career for you, which bits sound interesting, which bits you've got questions about. If you've attended any of the other webinars and you've already started your roadmap, you can carry on with that one. If you're new to us today, you can start a fresh one. You'll also have an evaluation in there with the option for a one-to-one follow-up as the last question. You basically tick that, and then a member of staff from your local Uni Connect, depending on where you are in the Northwest, they will be in touch with you to kind of see whether you would prefer to kind of chat over the phone, over email, or something different, and see what support you need. Okay. You'll also have the link to the Google Classroom. Again, we really, really strongly recommend that you guys are joining that, engaging in it. Every time we get opportunities like this or other opportunities, they go in there so you can have a little look. And lastly, we would really encourage you guys to sign up to further webinars. So this page should be familiar to you because this is how you signed up for the event today. And all the remaining webinars in this series, I think there are 2 or 3 left, They are all on here. So we really encourage you, sign up for an extra couple, extend your knowledge of the NHS. You've heard our interviewees today talk about how they work with different professionals across the NHS. And this is a good way of gaining some of that existing knowledge. Okay. So again, you sign up exactly the same as you did for today. If you've got any general questions, you can ask myself. You've got all our email addresses. You can also ask Abby, who generally does the admin for these events. But yeah, that is pretty much it from us. So thank you very much for coming along, guys, and I hope you really enjoyed the rest of the evening. Okay. We've got no questions in the chat, so I think we have definitely provided our students with lots of knowledge today. So thank you very much, guys.